Early data suggests elderly people are twice as likely to develop a serious case of COVID-19 and far more likely to die from the disease. As Tina Lovegreen tells us, adding to that concern, news this weekend of an outbreak at a long-term care facility in British Columbia.
Undeterred by the coronavirus, they came to Sunday morning service with a plan.
You're not going to jostle up against somebody else, so keep your distance as best you can.
Avoid mass gatherings and limit interactions. The warnings from health officials have become more urgent, especially for the elderly.
We know that the risk for elderly people having this disease is very concerning and that they are more likely to have more severe disease.
The scenario officials were dreading has become a reality. A long-term care facility in North Vancouver, now the site of an outbreak, with 2 residents testing positive for the virus, along with a healthcare worker. It's not clear where the healthcare worker caught the virus or how many facilities she works for. The province's top doctor acknowledging the growing risk.
And I just know how stressful it is for our healthcare system, for my colleagues, and for families that are dealing with this.
More than 200 people live here, including Althea Gibb-Carsley's mother-in-law.
She's 94, she has Alzheimer's and end-stage congestive heart failure.
The care center is effectively on lockdown, focused on containment.
They're doing what they can to protect the staff and make the best of it. I think they're doing a pretty good job. But families, I think, need to step up a bit.
Step up by not going into care homes if they're sick and practicing good hand washing. Standard flu season protocols now at a heightened level.
We are discouraging mass gatherings at care homes so that we're not having a large number of people, the public, coming into those places.
Many of the usual activities are cancelled, raising another concern for those most at risk: loneliness.
And that's going to compound problems with social isolation, which is a huge problem with the elderly.
Wash your hands.
These churchgoers have faith not in isolation, but in common sense precautions. Tina Lovegreen, CBC News, Vancouver.